Good morning, good afternoon, or good evening, whenever or wherever you may be joining us, whether you're a night owl or a morning bird. Welcome to the Richard Watkins podcast, where we sit at the intersection of science, society, and strategy, speaking with thinkers and leaders shaping the future. The Richard Watkins podcast is a production of the Science Policy Action Network, or SPAN. SPAN helps organizations navigate the complexity of policy, science, and innovation from research-driven strategy to on-the-ground advocacy. We connect ideas to impact. Whether you're a public institution, nonprofit, or private firm, if you're working at the intersection of knowledge and action, SPAN is your partner. Learn more at www.span-inc.org. That's span-inc.org. But today I'm joined by Neal Shah, CEO and co-founder of CareYaya, a fast-growing technology-enabled caregiving platform that's reimagining families' access to compassionate, affordable care. Under Neal's leadership, CareYaya is not only solving practical problems in elder care and respite support, it's also creating meaningful opportunities for students pursuing careers in health and caregiving. Its model grounded in innovation, empathy, and systematic change. And this episode will explore how CareYaya began, the structural challenges facing families and caregivers alike, and the bigger vision behind building a more equitable, accessible care economy. So let's get into it. Neal, how are you doing today?
I'm doing really well, Richard. Thanks so much for having me.
All right, let's back all the way up, all the way up, all the way up. Neal, tell us a little bit about your background. Where did you go to school? What did you train in? Tell us all about Neal, the man behind all of this amazing work.
Yeah, sure. Thanks, Richard. So, for me, caregiving is kind of like a second act in my life. I kind of fell into it when I was in my 30s, and now I'm in my early 40s, and it led to both a personal and professional complete shift in my life's focus. Kind of quick background on myself: grew up in North Carolina, went to school at the University of Pennsylvania, and right after, was working on Wall Street. Went into investment banking in New York City. Very quickly went into the hedge fund side, and by my late 20s I found myself becoming a partner at a multi-million-dollar fund, and then by my early 30s I started my own investment fund with backing from one of those investors, and grew that from 10 million to 250 million under management by the time I was 35. So I was kind of investing across healthcare, technology, even other traditional industries like paper and packaging and oil and gas, et cetera. And I was kind of like good at turning around troubled companies, restructuring, and then also finding opportunities and new trends. But really, I'd say the pivot in my life was personal. I in my early 30s went through caregiving for my grandfather through dementia, kidney failure, cancer, and then end of life care. And really, I'm the person in the family who helps a lot with research and navigation. And, I helped a lot in that process, but really the majority of the care work fell on my mother, who left her career to do it full time. And, my biggest observation then was just how difficult the care experience is. I think, I was born in India, and actually, I'm an immigrant to the U.S. as a child, and there's a perception among the world that America has the best healthcare in the world, which is true in a way, right? Like we have the best therapeutics, the best biotech companies, some of the best surgical procedures, machineries, amazing hospitals. But I think what's really missed is when something like that happens to you, when you get dementia, when you get cancer, it's like they say that the whole family gets cancer, the whole family gets dementia, in terms of it's really 95+% of the care is happening at home by loved ones. And in that, I think we don't have innovation. We have so it's almost like a tale of two cities. We have the best health care, but we have the worst kind of social care. Um, and that really falls on individual people, family members, spouses, adult children, et cetera. So I kind of realized through that journey how broken the care market was. At that time, I was still running my fund. So I became very obsessed with that. And I was like, oh, I wonder if there's opportunities to invest in this. There must be some companies doing this better, et cetera. And then after he passed, I was still running my fund. My wife then became severely ill and went through a multi-year bout with cancer. And I was her primary caregiver. And at that time we were living in New York. My family lives here in North Carolina. Her family lives in Michigan. So it was like no help. And it was like very difficult. And just found to be exhausting journey. A lot of times, it was touch and go. There were multiple hospitalizations, ICU stays, and I kept taking sabbaticals from my work to manage her care. And ultimately, made a very difficult decision just to kind of walk away from my career and become her full-time caregiver. Because I thought that it would have an impact on her outcome. And also, the quality of the care we found was just like really subpar and mediocre. So it resulted in a lot of guilt that why am I outsourcing this instead of doing it myself? So that was kind of like the long story short, I guess, of the journey. And through that whole process, we ended up relocating, moved back home to North Carolina. Thankfully, knock on wood, she finally had a successful outcome and has now been in remission for several years. And at that point, I was just like, okay, sometimes you have like a little bit of soul searching when you're like middle of your life. At that point I was almost 40, and I was just like, okay, what am I doing with my life? I'm good at finance and business, but should I go back to that, or should I use my skills to like do something meaningful here, where I've discovered through years and years of caregiving journey, being in so many caregiver support groups, talking to so many individuals who are dealing with this stuff, just how stressful, kind of guilt-ridden caregiving is, how there's a lack of good supports available to people, how many people are dealing with this. That some of the statistics are 63 million people today in America are taking care of somebody in their family that's aging, disabled, going through serious illness, 15 plus hours a week, of unpaid work. So it's a massive, massive crisis, and just like the support system is not really there. So I was like, okay, let me focus my creative energy and my skills to improving care. Because I think there's like a huge opportunity and unmet need, and I think there's a huge social impact. So yeah, that's kind of like the short, I guess long story short of how I ended up starting CareYaya.
So, I mean, people getting sick is not a new thing.
Yeah.
Why aren't we good at caregiving, like as a society?
Yeah. I think yeah, that's a great question. I think there's a few factors. I think one is there's an expectation on the caregiving side that it's something that's a family matter or a private matter, which, may have been, I don't think it's necessarily a fair assumption, but maybe 50 years ago, 100 years ago, when everybody didn't have to work, that could have been partly true. But I think, second assumption is people haven't lived that long typically throughout history, let alone live that long off that many years needing care. So if you kind of like think maybe those two factors, right? That not everyone in the family was working, 50 years ago, 100 years ago, and most people lived and then suddenly died. Now you have a different, the factor has changed, right? Oh, sorry. And the third is the family lives close to each other. Grandparents, kids, and grandkids all living within 10, 15 minutes. I think within a matter of two or three generations, all of those have changed. Typically husband and wife both working, right? Oftentimes, people are living far away from each other. Grandparents, then adult children, and then grandkids might all be living in different cities. And then life expectancies have skyrocketed, and oftentimes people are living into their 80s and 90s, but the last 5 to 10 years of their life isn't necessarily like good years where they're living fully healthy. They're living with a significant dependency on other people to be able to live, through either cognitive decline or physical frailty. So the total care needs of society have skyrocketed, I think, in the last like two, three, 4 decades. And at the same time, the ability of family members to shoulder that burden has completely plummeted due to their own work circumstances or due to their own just kind of like geographic, distance. So I think that it's something that society has maybe not paid enough attention to, and it's kind of the gradual crisis has escalated to now the point where it's like an epidemic. It's like hitting a lot of people. So I think eventually society will catch up, but it just hasn't catch up yet.
I mean, well, it takes innovators like you who have these life-changing experiences, and then you're in a position to recognize that gap, and
Hmm.
then you start coming up, with solutions
Yeah.
because, of that experience that you've had, which you just explained. So I guess now, tell me a little bit about the solution that you came up with, because it's amazing and it's
Yeah.
extremely successful. So What is that innovation that you've come up
Yeah,
with?
yeah, thanks. I think, so one thing I observed in the care industry through all my care experiences within my family was the typical method of kind of getting care help. When you find yourself in the situation where you got to take care of somebody who can't take care of themselves, and you're like, okay, there's a lot to do. And if you're working, let's say, in the case of my grandfather, or even in the case of my wife, you might say, okay, let me find a way to get some help. So the prevailing way that works is an industry that, kind of evolved 30, 40 years ago, which is this home care industry, where local care companies who are like affiliated with national franchisors will, they'll kind of run a local franchise banner, do a lot of sales and marketing advertising, and, help you get caregivers, to your home to take care of your loved one. And they'll typically charge anywhere from, 32, $35 an hour. They will then turn around and a lot of that money goes into administrative overhead, sales, marketing, royalties, whatever. They'll turn around and pay the caregiver maybe 13 to 15 bucks. So that's kind of the prevailing model. And that's just like people just view it as that's just how it is. Now, what I, as the person kind of engaging the industry, finds as an experience is spending a ton of money. If you need kind of 30, 40, 50 hours a week of care, you're like very quickly spending thousands of dollars a month, and the person is not making most of the money that you're spending. So you have people that are tired, that are often, doing second shifts at the food line or the grocery store to make end meet. Oftentimes there's a reliability challenge where 15% of the time, industry average sessions are multiple hours late or no show. And then you're just like, well, I can't go to my job because the caregiver didn't show up, and can't blame them. They're not getting paid that well. And frankly, the turnover in the industry is very high. Like very few people stick in those jobs because they are very emotionally taxing, physically taxing, and you could get better pay working at, Walmart or McDonald's. So, why would you stick with it? So I think you have this challenge where in the traditional care industry, the quality of the care is so poor that many family caregivers, even first, it's an affordability issue. Many people just can't afford 35 bucks an hour if they need 40 hours a week or more. And then some people will just be like, well, I'm paying all this much, but still the care quality isn't great. I'll just do it myself. So I thought that was like fundamental problems for like cost and inconvenience combined with low quality, creating a guilt on the family caregiver that they should just be doing it. So where I found kind of an interesting innovation opportunity is some of the best kept secrets from all the years of being in the caregiving support groups where people would realize the industry sucks and they would just go to the gray market, and there's a very large gray market in caregiving where people find caregivers themselves. And I think that
Gray
shows
market,
you, oh,
gray market, break that term down. What do you mean by gray market?
oh yeah, sure. Yeah, gray market. Like gray market, I don't know, I guess I don't know how to explain it, but okay, how in certain countries there's like a black market when like something is not legal or not able, like back in the day in like Russia when it was like full out communism and like you were not allowed to sell potatoes at the grocery store on certain, months or whatever, right? So there'd be a black market where like, okay, well, there are potatoes and people just trade them with each other, but it would be kind of unofficial or under the table. So oftentimes, sometimes I find, in repressive or poorly, kind of structured environments where the official industry is not doing its job, a very thriving black market or gray market, and I call it gray market because it's like kind of informal, it's not illegal, but like a kind of an under the table market will develop because people don't like transacting in the formal market. And actually, and yeah, thanks for the question because I just kind of randomly came up with a Russia idea. But I mean, this happens a lot, in like broken systems. It's like, what's the market in North Korea, to kind of get clothing or food? I'm sure pretty much a black market, right? Because like whatever the government's allowing, it doesn't, fulfill the needs of the people. And often there's like other markets that develop. And I mean, I'm just giving examples of like extremely repressive and, broken systems. But I guess it's the analogy holds here where like the formal caregiving system as run through these kind of care agency franchise or franchisee model is such a crap system. No offense to anyone, but like just from having used it myself, that many people, I'd say the majority of people are turning to let me figure this out on my own. So that's
Mm,
kind of what I mean by gray market in the sense of like it's not illegal for people to find caregivers by themselves. So not technically would be considered like black market, but like more gray where it's like you're not engaging in the formal economy. You're kind of doing it on your own because you're like the solutions aren't really working.
makes a
Um,
lot of sense. Yeah.
so, and I'd say probably two-thirds of the caregivers I found that were family caregiving for somebody through illness or disability are relying on that gray market where they're going around and finding caregivers themselves. They're putting up flyers at church. They're going to kind of like sometimes people go to Craigslist, believe it or not, to find caregivers. They'll find they'll talk to their neighbors and be like, oh, somebody's son or daughter isn't working. Sure, do you want to care for my dad? Somebody might be down the block, a stay-at-home mom, and they might be like, oh, can you care for my mom or dad? So people are finding their own solutions because the system isn't working. And within that gray market, I found actually a really interesting thing that a lot of people are doing is they had figured out that healthcare students, people who are in nursing schools, people who are pre-med, people who are students studying to go into clinical careers make for amazing caregivers. And, I'd done that myself. I had actually found a bunch of caregivers, family caregivers who were doing it consistently. And that was kind of like the initial inspiration or the idea was like, hey, there's a way to do this in a structured and bring it to the formal market or the formal economy and, create a convenient, a high trust solution with full vetting, ease of booking, and kind of just bring this into the formal economy. Because when you're doing it yourself, as I have and as many caregivers have, it's extremely exhausting. You got to go to your school. You got to get to know the professors. You got to put up flyers on campus. You got to interview and vet all these people by yourself. You got to create a rotating schedule. Who's going to do Monday? Who's going to do Wednesday? Who's going to do Friday? So like we knew families were doing this. They were putting a lot of time and energy into it, but getting care from healthcare students was by far and away the best experience that families found because these students are extremely reliable. They're highly motivated to do a good job because they have like kind of future trajectory they're trying to get to is I need to get into my nurse practitioner program. I need to get to my physical therapy, graduate degree. So I'm going to do a good job. And as a result, they're very on time. They're really great at building relationships with the people they're caring for. So, I think you have kind of like a cut above in terms of the care quality. So that was kind of the idea of CareYaya in a nutshell is how do we create a tech-enabled solution to bring this into the formal economy? And, that's basically what we did. We started here at UNC Chapel Hill and Duke University, eventually expanded to NC State. Within the first year had a few hundred joined the platform, nursing students, pre-medical, pre-physician assistant, physical therapy, occupational therapy, anyone who wants to go into clinical fields. And, it's like worked really well. Families were like, wow, this care is amazing. We also did it at like very, very affordable rates, so unlike the traditional industry that charges $35 and pays the caregivers, 13 to 15, we were just like, okay, no fee and no markup book online and it'll be 17 to $20 an hour and family will just pay and all that money will go to the students. So we did that in like a pretty cool way. So students are making good money. They're very motivated to do the care. We built the relationships with the pre-health career advising departments at the universities, the biology professors, sometimes, in physical therapy, occupational therapy, et cetera. And yeah, after now, we've only been around for like a little over 3 years, but it's gone viral nationwide. Now have over 40,000 students at over 35 universities, on our tech platform, providing care in their communities, and we're in, over 15 different cities. So that's been really awesome to see.
And it's not just care, it's quality care, right? I mean,
Mhm.
I've watched a countless number of your interviews in preparation for this interview. So
Thank you.
hopefully my interview right here reflects the homework that I put into it,
Thanks.
right?
Thank you. Yeah. Thank
But
you.
I also remember on those interviews that when reviewed, the
Yeah.
care that you provide and the students that you employ is rated very, very highly.
Yeah.
Why is that, and how do you kind of define good quality care?
Yeah, great question. I think part of it is we do a lot of vetting, not just kind of vetting of like interviewing and background checking and kind of like understanding motivations for caregiving when people are applying, but even more so where we get students from. So, it's not just anyone is applying, it's we're building relationships with professors and pre-health career advisors. And then they know their students, so they're sending the best ones to the platform. And over time, a vibe is building that like good students who are good and aspiring to clinical careers and really want to do this, not just for the money, but really for the experience, so that they can be future better nurse practitioners and better doctors. Those are the ones signing up for the platform. And then, we put them through a pretty extensive process of interviews. We've kind of now tens of thousands of students on the platform, and we have so much data on how students are doing care. It's almost like we built a technology system that has learned from the data of what types of questions and answers to the questions indicate who's going to make a good, reliable, trustworthy caregiver. So it's kind of like a really technology can help train, faster. And then of course we do a lot of heavy upfront vetting. And then critically, each care session has a rating very similar to Uber. Each care session has a mutual rating. The student rates the family rates the student, 0 to 5 stars. And proud to say now, after tens of thousands of care sessions, average ratings are like 4.87 out of 5 stars. And partly it's because if we notice below 4 stars more than once, we'll reach out to figure out what's going on. And if we don't have a satisfactory explanation, we'll deactivate the profile. So I think it's like rigorous quality control combined with the way they're coming into us is kind of like high trust. And and frankly, I would say part of it is just like the nature of the workforce. Like students who are aspiring to graduate school and future clinical careers are just like totally different in their motivation. Like they're going to do a good job because this impacts whether or not they get to graduate school. This they will ask us for letters of recommendation. I proudly have written hundreds, if not thousands of letters of recommendation for people, and many of them are now currently in medical school. They're in physician assistant school. They're in nurse practitioner programs or doctors in physical therapy. And I think it's like really awesome to see. So I think that there's a different intrinsic motivation in the students, and I think that creates like an amazing experience.
Hey, also huge shout out right there for mentioning that process of letter of recommendation. For anybody who is listening out there, do your best work every chance that you get, because you don't just want a letter of recommendation, you want a strong letter of recommendation. Again, the
Yeah,
Richard Watkins podcast, sitting down with Neal Shah, the CEO and founder of CareYaya. Thank you so much, so much. Gosh, where do I go from here? I have so many questions,
sure.
but I kind of want to make a pivot a little bit. And if I'm pivoting too hard and I'm leaving a particular topic that you wanted to talk more about, please just grab
Sure.
the steering wheel from
Okay.
me and steer this ship wherever you think it needs to go.
Sure.
But one of the things I work in an office, and I think I'm in a great space, and then I leave and come back after getting some fresh air. I come in and I'm like, oh man, I didn't realize my office smelled so bad, right? It, I say all of that. That's a little kind of funny kind of story to tell, but I say that because oftentimes when you are in an environment, when you are in an industry, and that's all you know, as you said earlier, that's just how we've done it. You don't even
Yeah.
realize that what you do stinks, right? You don't even
Yeah.
realize that your space stinks. And
Yeah.
so you've come from a completely different industry
Yeah.
into this new one, and you're able to see and with a completely different lens or a point of
Yeah.
reference, and you're
Yeah.
able to come up with all these ideas. And so you're not only able to create an amazing company, but you're also able to write an amazing book. So not only are you an
Oh,
entrepreneur
thank you.
and a caregiver, you're also a best-selling author. So
Thanks.
listen, I wanted to create a space for you for a
Thanks.
plug.
Sure.
Please tell us a little bit about your book and
Okay.
tell us a
Yeah.
little bit about what it is that you're focusing on.
Okay, thanks, Richard. I appreciate it. And it's kind of hard to pivot because like the other thing is so like uplifting and positive. This is kind of like a difficult topic to talk about, but I think nonetheless, both are very important to talk about from a social impact, and I think that there's different ways to make social impact. So the book, here's the book, it's called Insured to Death: How Health Insurance Screws Over Americans and How We Take It Back. Just came out less than a month ago, and pleased to say, just kind of like we quietly published it, and it's become now number one nationwide bestseller in health policy on Amazon. So, definitely feel free to check it out. It's also available at Barnes and Noble and stuff. But yeah, really, the book was born also out of personal experience and really out of experience of running CareYaya. So to kind of like, there's a positive thing we can do to connecting healthcare students to care for, our vulnerable populations. There's also a huge negative thing I've lived through and I've seen so many people live through, which is people are facing extremely high rates of denied claims for health insurance. People who think they have coverage, whether it's younger people or middle-aged people on, the ACA, kind of Obamacare plans or on their employer health plans, or older adults who are often now on Medicare Advantage, which are private health insurance plans, which now over half of older adults in America are not on traditional Medicare, but on for-profit Medicare Advantage plans. And these insurance plans, denials of claims are escalating in the last 3 or 4 years, to like upwards of 20 to sometimes 30% of legitimate claims are denied. And I think this is a crisis. Over 60 million adults in this country have had a denied claim in the last year. I mean, that's just like shocking and infuriating. And I think it's also relevant for our students because many of the students want to go into clinical careers. And number one cause of physician burnout, nurse burnout, and other clinical professionals burnout is the administrative BS and paperwork that goes into fighting claim denials. So I think something like 78% of physicians have said claim denials have skyrocketed in the last 3 years, and it's making my job miserable. So it's almost like healthcare, which used to be kind of like people who go into healthcare want to heal the sick, and reduce suffering in the world. People who need healthcare are the sick and suffering who need to, feel better. And you've had this middleman show up, which is health insurance, who is now breaking that sacred relationship and just creating, in my opinion, a complete harm on society. And the book, it's kind of like the cover is a little bit eye-catching, where, it's like showing the denial letter from the health insurance, industry, and the shadow being a gun. And I literally think that the health insurance companies are killing people, by denying care. And so why, I wrote about this is, through my wife's cancer journey, we experienced significant denials of claims, for hospitalizations, for therapeutics, even sometimes even for minor bills. And it was like major or minor during a time when somebody's battling cancer and is extremely stressed. Whole family is stressed, right? I'm stressed as a caregiver. It adds insult to injury to get $30,000 bill and then panic of like, what is this? Thought it was covered, and then spend hours and hours fighting all the negotiation, all the weeks and weeks of back and forth, kind of like worried about financial toxicity. And this is something that I think is under discussed. But if you get cancer, it's like if the disease doesn't kill you, the financial thing will kill you. Like so many people go into medical debt and bankruptcy personally when they get a cancer diagnosis. I mean, it's like heartbreaking to see. And it's because the health insurance company just like didn't pay, and just screwed them over. Unexpected bills and kind of bureaucratic tricks to deny coverage of XYZ drug, XYZ hospitalization. And, I think it's gotten to a boiling point, to the point where late last year, we had a very public, the CEO of the largest health insurance company in the country got shot in broad daylight. And, majority of people on social media were like, who cares? And I think that kind of shows you that, initially it was like, oh, this is a not empathetic reaction and blah, blah. But I mean, if you ultimately think about the message from the people, it was, well, I've been screwed by them too. So, I don't have any sympathy. It's kind of like, the most salient comment I saw on social media was somebody, I thought, witty comment said, I feel about as bad as if a mafia boss got shot. And I think that's kind of true, right? This has become like a uncontrolled mafia that is not accountable to the patients it's supposed to serve. It's not accountable to the doctors that are dealing with it or the hospitals that are dealing with it. And I think it's just kind of become a beast on its own with minimal government oversight or regulation. And that is like actively harming tons of people. So, well, I wrote the book is from, I thought my personal experiences were just like, in isolation. In years of running CareYaya, I've now observed these are the experiences of tons of people around the country. Tons of older people living with dementia, tons of people going through cancer, people with metastatic cancer who have 2, 3 years life expectancy are being denied critical drugs. Sometimes their family caregivers who are middle-aged people are being denied meds for their own health ailments. So I've seen so many families struggle with fighting denied claims. They don't know what to do. Interesting statistic is of 99, like of all the claims that were denied, 99% of patients don't appeal and fight back. The 1% of people that appeal and take the time to fight back, half the time they win and they get the claim in their favor. So when you see a statistic like that, you're just like, well, the biggest public health problem is most people are too scared or intimidated to fight back. So how can you empower people that they have rights? There's ways to fight back. There's ways to create very well-crafted letters of medical necessity, fix billing code errors, escalate it to state insurance regulators, take it to court if you have to. But there's a whole playbook. So, and part of the book is in the book, I laid out a very detailed playbook of like how we got here, how is society in this mess of a situation that the health insurance companies are just getting away with denying all this care, and really a whole playbook for individual people. If you find yourself in this situation, how can you fight back? For patients, but also for physicians. If people are in this situation, how can you streamline helping fight back? And as a passion project, we built a suite of free AI tools, which we call Counterforce Health, to help people fight back. And it was just like an internal project we were doing at CareYaya, but then we put it out into the world as a standalone thing because we realized not just people caring for older people with dementia need this, but everybody could benefit from this. And the thing has just been getting absolutely flooded. So many people are using the tools. And we basically made a very simple AI system that upload your insurance coverage policy document, upload the denial letter that you got for the care that you were denied, upload any relevant, kind of healthcare records, and we will take care of everything for you. So the AI we train on billing databases, so it can fix billing code errors. We trained it on a lot of medical research journals. It can kind of it's trained on a bunch of different medications and how to effectively argue to get that medication. It's trained on appeal strategies from a lot of state insurance commissioners' websites have decisions from external reviews. So you could kind of train it on successful appeals that have worked. And now, instead of somebody finding themselves in this situation and saying, okay, I don't know how to do this, or I got to call my brother who's a doctor and have him take 8 hours to write a detailed letter with all his research. Now that AI can do it for you in 2 minutes. And then you can just kind of sit there and edit it and, fact check and make sure it has all the links. And then you can just see, okay, is this good? And send it off to your insurance company. So we noticed we rolled this out and a lot of people are flooding our site. The site is counterforcehealth.org. So COUNTER, force, FORCE, health.org. And you can use the free AI tools, or you can send us a message and somebody on our team will help walk you through it. But yeah, we think it's a huge, public impact project that, government is too slow to act here. Government is not stepping up and regulating these insurance companies. I'm pleased to see recent headlines, that finally, even at the federal level, DOJ is investigating United Health for not only civil, but criminal investigations going on into their Medicare Advantage business. So I think it's finally starting, but I just think some of these things move slowly. And in the meantime, all these people are suffering. So we're like, okay, what can we do about it? So that was both the genesis of the book and, kind of like the AI tools and the movement, we just think that people are drowning in this stuff.
That's incredible. I think one of the things that I'm really curious about, and just to get your thoughts on it,
Sure.
um, the inclusion of artificial intelligence, of AI,
Mm-hmm.
it's absolutely everywhere. Our lives going forward are never going to be the same.
Yeah.
I heard you explain that decisions on whether or not someone's claim is going to be rejected is impacted by the utilization of AI or large language models that goes through and makes decisions on these
Yeah.
claims.
Yeah.
Talk a little bit about that, because I think it's important for people to understand how they are interfacing with this
Yeah.
revolutionary technology.
Yeah. No, I mean, great question. Yeah. So chapter 3, I'm glad you brought it up. Chapter 3 of the book, detailed expose on that, not to name names, but I will, big company Cigna, one of the biggest health insurance companies, they were just busted for a CXDX algorithm. 300,000 denials of claims, average 1.2 seconds. So, legally, you're supposed to have a human review this stuff. There should be a physician at Cigna looking over why something was denied. Now they claiming, maybe there was some oversight, but 1.2 seconds on average for the denial. So it's kind of I don't even know if somebody's glancing at these things or just the AI is doing it. United Health, big Pulitzer Prize investigation, I think a year ago by Stat News. They had a AI algorithm with a 90% denial rate of claims for older people who are couldn't take care of themselves and were living in skilled nursing or assisted living facilities. Because, and this is my speculation, right? But the reporters have kind of speculated that they were guessing who doesn't have the family or the staff to be able to fight back, which is old people who can't care for themselves. So 90% denial rate. I mean, this is absurd. So I think, the reason for the book and even the movement of us building the AI tools was I think that the health insurance companies, because they have so much money, it's 3 or 4 years ago, they started weaponizing AI because they're like, oh, we can just have AI do it now. And when one side is using AI to make a decision on your health in 1.2 seconds, and then you get that letter, even though half the time or more it's BS, and you have to spend 8 hours writing your defense. And 99% of people will just give up. So now the insurance company makes free money because they don't have to pay it out. you don't get the drugs you need, you don't get the hospitalization you need, you don't get the physical therapy you need, your health is worse off, or you pay for it out of pocket. So either way, you're screwed. So we kind of thought if one side is weaponized AI, and I think this is a kind of interesting broader point across society, AI is being used a lot. So in hopefully growth cases where AI is being used, everybody's better off and the society's moving ahead and blah blah. But there are some cases where AI is being used where it's one side versus another side. And I'd say in health insurance, that is a opposition battle. The health insurance company is using the AI against you. And if you are not using AI or modern technology, and you're manually writing letters, you are now, somebody shooting a gun and you're fighting back with a knife. You're going to lose. So that was kind of our whole point is that this is happening. They've done it first. They're screwing over all these people. Government's kind of sitting there slow playing this, not taking action or not taking action fast enough. So the only way to solve it is make the weapons make the weapons for small clinics, independent doctors, people who don't have these kind of resources, and deliver them a really good AI weapon that can programmatically fight back. Where this goes long term, who knows? It's going to be AI versus AI battle. But I think that collectively, there are way more patients in America, way more doctors in America, way more nurses in America than there are health insurance company executives. So if the willpower of the mass is there and they just have not had the access to the tools, then if we can kind of build creative tools and over time keep improving the quality and, kind of solve the social problem, then yeah, I mean, there's a decent likelihood of winning. And we're observing that. Now over 70% of people using our tools are winning claims, and I think that's amazing to see the impact. But many of these people, more importantly, there's the win. Many of these people wouldn't have even tried to fight back, and I think it's awesome just to kind of like give people the confidence and empowerment to fight back. Same with the book, right? Wrote a long section in the book about all the rights. A lot of people are surprised. They didn't even know that if you appeal to the insurance company a few times and you lose, a lot of people don't even know you have external review rights where you can take it to the state. And the state insurance commissioner will assign independent people that are not affiliated to you and not affiliated to the insurance company, totally independent, many of whom are retired physicians to adjudicate that process. And oftentimes, majority of the time, that goes in the patient's favor. A lot of people don't know these rights. So it's like a complete bureaucratic mess of a system that I think many times people who are sick find themselves in. And because they're already sick and they're already so stressed with their health, they're like, I don't want to deal with this whole like financial and bureaucratic health insurance navigation side, so I'll just give up. And the company is preying on that because then they just get to keep the money. So yeah, I think it needs to be solved. My in my
Yeah,
dream, just the health insurance industry would be either massive regulator or just gone. But in the
yeah.
meantime, I don't think that's happening anytime soon. So
Well, that's absolutely fascinating, and I hate to walk away with this conclusion that it seems like the best form of healthcare is wealth. I think I said that right.
I
I
guess,
think I said
yeah,
that right. Yeah, I
yeah,
think I said that right. Yeah.
yeah.
That's the best medicine is just wealth. Yeah,
I mean,
that's what
well,
I'm coming
you
away
know what?
with.
Couple of things. I'd say one for certainly wealth. Another is kind of take matters in your own hands. That it's kind of like empower yourself knowing that you're up against this broken system, and then oftentimes I think in the case of like this, when the you think you're insured, but you have this illusion that if something bad happens to me, I'm going to be, covered. But if you know that's an illusion, then you may start planning it differently. Because I think that's the myth or the mirage, I think, is that you have health insurance, I'm good. When something bad happens, I'm good. It's like if you know that you get cancer and no one is going to help you, or you might be completely screwed and you might out of pocket, then you might start setting aside, some money. And I've observed this, in countries, so, my family came from India and it's like they don't really have an insurance system, much to speak of. So whether it's rich people, poor people, middle class people, people always just set aside some money because they know, hey, there's some probability that I or somebody in my family is going to have a major health event and no one's going to pay when that happens. So if I don't want to be out on the street or I don't want to die, I will have set aside this rainy day fund for when that happens. And I think it's, one of the interesting things I think about in like American kind of like public health or health policy is when you have this false illusion that the thing's going to get your back, you almost don't save because you're like, oh, I already got this protection, right? Which like I'm paying for through my premiums or my employer's paying for or Medicare's paying for, whatever, right? You think you have that. But if you just kind of took away the illusion and you're like, hey, you're just going to be, think about worst case, you're going to be on your own, then people might say, okay, you know what? Every month I set aside, a few $100. And then when the thing strikes, I did that math actually during my wife's illness. At that point we were in our mid 30s. I had paid health insurance premiums for better part of 15 years, right? Since I came out of school and I've been working. And I like outside of going to the doctor, which is like once every 3 or 4 years, I don't even engage with doctor system embarrassingly that much. I was kind of calculating, okay, how much have I paid into this compared to how much have I taken out, right? Like 100,000 plus has been paid in, right, over a decade plus. Same with my wife. So it's like imagine if there wasn't this weird system where you have this illusion that you got coverage and all that money we had paid into health insurance premiums somehow we had just like put into a savings account. Could have afforded all that care, all out of pocket, and still had money left over, to spend. Instead, paid all that. Then, when the thing happens, random bills keep getting denied. So you're wondering who walked away with all that money that I just paid. Now I'm denied XYZ thing. I gotta now come out of other savings or, take that, right? I mean, it happens to a lot of people. So I think that's kind of the thing. There's an illusion of coverage. But, so you're right. I mean, I think that wealth, yeah, it's like sad that that's like the answer, but it's helpful, I think, for people to understand there's an illusion that you're not really covered when you need it. So maybe take some matters into your own hands, kind of. And then finally, the other thing is just like, I mean, I know a lot of people can't avoid, things like cancer and serious illness just happen to people, but other health things, if there's anything that is possibly preventable through lifestyle modifications of blah blah, it is like highly, highly suggested to do that because the system isn't going to be there for you, So it's kind of in one way, it's like people just, I mean, I hate to say it. I mean, I'm a generally a very optimistic person, but I just am somewhat pessimistic about how major institutions are failing to serve the needs of the people. And when you end up in a society or a situation like that, you got to more rely on yourself, So, yeah.
So, man, again, Neal Shah, CareYaya, we're very respectful of your time. We're going to wrap up
Sure.
right here. But what happens is I talk to amazing people all the time. You're one of them, and they have so many great things to say. And I just want to make sure I pull all of the great, juicy bits of information from them. But without exception, the call ends, the interview is over. And I'm kicking myself because I wish I would have asked this question. So we always end with this same question that I ask to every single guest, and that is, what question should I have asked?
Ooh, man, that's a good one.
And they always give me that answer. They
Maybe,
always say,
yeah,
"Ooh,
yeah, yeah,
man."
I know. Okay, like, you know what? The question to ask is, how can we build a better healthcare or, care system that actually serves the people it's supposed to serve? So,
I'm sorry, I unmuted, then
oh
muted
yeah,
myself
sure,
again.
sure.
All right, listen, really quick. Do you have any ideas on how we could do that?
Yeah, I think so. I think my answer on that because I often think about that. Why isn't this better? I think probably number one is through conversations like this. I think that many people who go through this situation, as I've personally gone through several times in my life, think it's just happening to you. And I think kind of the biggest takeaway in the whole thing, and by the way, I don't want to condone violence by any means, right? So, but I just want to make an analytical observation of when the United Health CEO got shot, that there are moments in society and in history when something happens and then the reaction happens and it's kind of like emperor's got no clothes type of situation where everybody in the crowd was like thinking something but maybe thinking it's their own thing and no one's saying it, whatever, and then you see something and you're like, damn, everybody else thinks that way too, and I think that sometimes I think it's like an awareness thing, and you study societies like this, like, I remember I was reading a book about like an extremely repressive regime in like what was back then Czechoslovakia, as part of the Soviet Union, and under before the fall of communism and the Berlin Wall, like people there were extremely, extremely repressed. And, I think there was something where, and I botched the story, but I read it in a book a long time ago, but it was something like, the new Pope kind of came and all these crowds gathered, right? And it was like the first time a bunch of people were packed in stadiums doing something that wasn't related to the government. And it was the first time a lot of people saw that all of the people are actually quite united and all of the people have a lot of similarities and that they don't like the repression that's going on, in the society. And I think that was like the start of the end of that repressive regime and of the eventual freedom of the Czech people. And I think that that is like a real thing I see now in like caregiving, in kind of insurance battles. Like I think that there is like a little bit of a wake up of like the entire society that some of these systems are like extremely repressive and biggest institutions are completely failing the people. And I think as there's more awareness and I think there's more kind of like podcasts, detailed interviews, it like I hope it makes people think they are not suffering through this stuff alone, that there's a lot of other people like them. And that can inspire like collective action in a positive, nonviolent way, to advocate for systemic change. And sometimes you'd be surprised, like that stuff does end up changing. Repressive systems that have lasted for decades sometimes will change very fast, and into kind of the system it's supposed to be. And I think that that's kind of my biggest hope.
Neal Shah, the author of the best-selling book Insured to Death and CEO and founder of CareYaya. Thank you so much, Neal. I appreciate it. Thank each and every one of you for tuning in for the latest and greatest episode of the Richard Watkins Podcast. The Richard Watkins Podcast is a proud production of the Science Policy Action Network. Remember, folks, that the future is not something to wait for. It is something to build. Thank you all so very much. And until next time, take care.